Hello, Hema.
Hi.
Yeah.
Hi.
Meet Dominique from Paris.
Okay.
She's a journalist based in Paris, and she got in touch with me about 2.5 years ago.
Okay.
She contacted me over email stating that she would like to get some dental treatment done,
Okay.
and then we had a long correspondence, and then she was here. And after that, she's been coming. This is the third visit she's made to India. And now she'll be more regular because all the dental treatment is done, but then she's got a lot more work to do.
Okay.
As a journalist, she's got a lot of work. That's what it is. And she's fascinated by India and Kochi, and I think she will tell us more about her experiences. I'm not the person to comment on that.
So, hello, Dominic.
Hello.
I'm sure that you've been in India for quite some time now.
Yes, this is my third visit now.
Okay.
And every time I stay about a month.
I've heard about you. No, the first time I met Dr. Prasanth.
Oh yes?
Yeah, the first time I met Dr. Prasanth, I've heard about you.
Do you know why?
Why is that?
Because my teeth were the worst teeth he'd ever seen in all his career.
Okay.
He was shocked. I'll never forget the look on his face when he first looked at my teeth. And he went from a sort of nice, welcome smile to total disaster area look. You know, he was feeling so shocked, so sorry. I thought, my goodness, this poor man's never going to get over it. And it's true, you know, I mean, my teeth were all rectangular, but he was the only one who was willing to do something and salvage my teeth and give me brand new, fantastic teeth.
I think the entire process is in, the full thing is done.
Yes, more or less complete. More or less complete.
Yes. But it was a mammoth task, and I think Dr. Prasanth deserved a medal.
Thank
So
you.
let us start from how it all began.
Well, the sad story of my teeth began a long, long time ago, and I spent an absolute fortune on my teeth, and the results were absolutely shocking. So I thought maybe it's time for me to have implants. Because I've been reading a lot about implants, everybody around me was having implants, so I thought, well, maybe that's the thing for me. So I contacted various dentists in Paris, well-known, searched the internet for them, and they said, okay, we want an X-ray, and we'll have a OPG, so what the OPG done, and all of them said, no, there is no way we can do implants. It's absolutely impossible. So I thought, right, I'll try some more, and got in touch with various other dentists abroad, and they said yes, but bone graft, sinus lifts, and even so, they have to take bits from your hips, graft them, bits from your skull, and I thought, oh my goodness, butchers. And I thought, well, what can I do? So I carried on researching about implants, and I found an article on basal implants. I didn't know anything about basal implants, so I started searching, and there was one dentist in Luxembourg, and he said, send your OPG. So I said, okay, and he said, yes, basal implants might be the answer, but you have to find somebody willing to do this, because I was taking my jaws and bone loss, is quite a challenge. So I tried again, and all of them said absolutely not. In the meantime, my mum joined me in the search. She'd been watching some TV program about fantastic Indian dentists in Chennai.
Okay.
Because I think that's where French people go to, because they speak French.
On the shelf.
Yes,
on the
that's
shelf.
right. So I thought, well, I don't have to do it. There I just start searching. And there were only 2 dentists in India doing basal implants. One dentist was near Mumbai, but he explained that he was spending 15 days in the surgery in India and 15 days in Dubai. So I thought that's not really a good idea for planning. I also then, after having tried everybody in Europe and everybody in North Africa, before that, I thought, right, I tried the only other dentist in India doing this. And then I found Dr. Prashanth's site, and I thought, now this is really interesting.
Okay.
Because everything on the site was clear, very well explained, detail by detail. I mean, not the technical terms, but for somebody who doesn't know anything about teeth, everything, and you had photographs, everything was very clearly explained, and anything you wanted to know about, from filling, to dentures, to implants, bridges, everything was really, really well explained. So, right, this is one really good point. And also, as I was looking around, the other good point was that, that's before the initial contact, that he was doing his work at Saraf Hospital if he smiled. Okay. So I thought, this man would be wonderful. So then I contacted him, and he, of all the dentists I contacted in India and elsewhere, he was the only one who didn't say, come, we'll deal with you. He was the only one who said, I don't know any time. So I said all the OPG, the x-rays, and then he studied my case very carefully, we exchanged, he asked all sorts of questions, and the whole thing took about 6 months. Right? And then he said, yes, I think we can do something for you. And then again, he offered a plan, a proper plan, proper treatment plan, and also with costs. You have to bear in mind that this can't be the exact cost because you don't know what can go wrong, but at least it was a plan with cost, and nobody else did that as well. He didn't ask for money in advance, he didn't ask for anything like that, he just said, look, this is, because I said, I need to budget. So he said, yeah, this is, but it might cost you that. It could be more, it could be less, but at least this is a basis to work from. So if it's more, it doesn't matter, but at least you know that, things can develop and you might have other influences. I mean, that's what but at least it was serious. And he also offered to help for accommodation. He said, look, you need to be close to the clinic. So
very, very, very important.
So that's very important, And he recommended a place, and that was fantastic because the homestay was great. Beautiful old house. It was close, within walking distance to the clinic, and also walking distance to a fantastic vegetarian restaurant.
Okay.
So all this was really, really well organized. So I said, I'll also need internet connection. They didn't have the Wi-Fi at the homestay, but I took it out, and I also need a new telephone, which is fitted out for me as well. And it was really like coming home, to some family, because he took such good care of me, introduced me to all his family. I became a member of the family, being fed and watered, beautiful Indian meals, 3 times a day, because I was so scared I was going to go back home looking really scrawny. So everything was fantastic, and I was so well looked after. The dental treatment at the time was absolutely tremendous because my face would swell up like a mad hamster, but the pain never lasted. Because I really had that pain in the morning, the following day I was always
Yes. So it was interesting to hear your how the entire thing went about. Now, could you tell me why you chose India, why you chose Dr. Prasanth? Yes, you did tell me before that he gave you a lot of details, and he was not, what do you say, this, how it will go about. So that was there, but then, what did you feel when you first came here? How was what was the minute you walked into this place, there would have been a first impression that you were left with?
It was really good. It was at Saraf Hospital.
Okay.
And there was a whole team of dentists just for me. You see? So I was giving star treatment I had 4 dentists looking at my teeth, you know, all together and commenting, and you know, because I mean he hadn't worked this plan on his own, Dr. Prasanth.
Okay.
He asked all sorts of specialists, like a root canal treatment specialist, also Dr. Rupesh, who deals with aesthetics, you know, and Dr. Rupesh said, oh, I make your teeth beautiful, so I said, well, I'm going to love this man. And then there was Dr. Maya as well, and this is Dr. Sreeja, Dr. Prasanth's wife, you know, and they were also discussing it. So I had this feeling that, you know, if I have a whole team of people, you know, looking after my teeth, I mean, surely, you know, things are going to work out. So I felt very reassured, you know, that they were so professional, and there was not just one dentist, you know, doing things. Because he said everybody is very, very specialized, and everybody does their own job, you know. I mean, which I would never have done in France.
But they got together well, and you know, so the entire treatment plan was put together by a team of experts.
Yes, exactly. Not just one, you know, a team of experts.
Okay.
And also, I just discovered that for basal implants, which Dr. Prasanth gives, you know, as I said, there are many other specialists in India doing that. Really, you need to be a proper surgeon because they're very difficult to do. Whereas the other implants, anybody can do. I mean, there's no guarantee of success. Because what I didn't tell you is that lots of people around me in France were having implants. But lots of people in France were losing those implants because they were not well put in.
Okay.
So there was infection, swelling, very, very, very bad temperature. And after 1 month or 6 months or a year, they had to have all the implants out and have dentures or whatever, you know. And basically everybody calls themselves an implantologist now. You know, you can decide to a dentist, I'm going to try to put implants in, well, let's see. And then you put 2 or 3 implants in and you call yourself an implantologist, and then you have problems. You see? Whereas for these basal implants, I mean, you could decide to put them in, but I mean, you know, they're so difficult to put in, you really have to have an excellent knowledge of dentistry, but not only dentistry, bone structure. And that's surgery. And that's why the fact that Dr. Prasanth works at Saraf, you know, gifting smiles and operates on people with facial deformities or people who've just been in a car crash and have all their teeth bashed in.
The trauma cases.
The trauma cases, you know. I mean, that was very reassuring as well.
Okay.
You know? So I felt really happy, and I mean, I wasn't worried. I'm not saying I wasn't worried about, you know, pain. You know, I was a bit concerned that it was going to be painful, but I was not at all worried that things would go wrong, or that I'd have infections, or that I'd lose my implants. I was totally trusting, and I was right.
Okay.
You know, I was 100% right, because nothing went wrong.
So now you have a beautiful set of...
Of course, the 8th wonder of the world, my team are now.
Okay. Could you tell me about your overall experience in India, so that, you know, if I'm sure there would have been something which you felt would have been better. Things where, because we do a lot of research and development on medical tourists who come to India as an organization, and we are refining their experience, or after understanding the problems they face, we are trying to find out solutions for them.
Yes.
So were there any things which you felt would have been better, or would have, we are sure that you had a pretty decent, good experience here.
Yes.
But then there would have been something which would have been the topping on the ice cream, or
sometimes when you can't communicate, you know, with drivers, auto drivers, because they don't speak English, that can be a bit difficult. And also when they don't know where they're going and they tell you, yes, I know where I'm going.
Okay.
You see, like you say, okay, I'm going to such and such place, and say, yeah, come in, you know, really. And then you find out they don't know where they're going.
They're thinking you, okay.
You know, but I mean, this didn't happen very often, but you know, it did happen. And also sometimes it's difficult to get an auto or a taxi at night.
Okay.
That's one thing that really needs to be sorted out.
Okay.
You know. because you want to go out and visit a friend or something, and then you can't stay because the auto driver says, no, I don't want to work after 9 o'clock.
Okay.
And it's difficult to find another one who is prepared to work at 9 o'clock, or one who is prepared to go over South Bridge because they don't want to go to that area. So I think, yeah, this is the one thing that could be improved.
In regards to the clinic, in regards to your experience here, anything which could have been better?
No.
Okay.
Absolutely not. No, no, no. I mean, where else in the world can you go and have your teeth fixed and watch an elephant having a bath?
So you did watch...
Yeah, and I filmed the elephant and I took photographs, you know. I mean, just tell me, you know, where you could have that sort of thing.
It's a dentist who has an elephant in his garden.
Yes, yes. And it's not a white elephant. It's an Indian elephant, you see. So, no, I think everything was fantastic.
Anything which doctor would like to comment? I mean, I would like to ask you, how is she as a patient?
Yeah, that's what, see, the most important thing in treatment, it's not just enough if the doctor is good, the patient also needs to be good. Which is very important, because that's one thing which we've encountered very often. Patients are very fussy. Patients create a lot of problems while during treatment. They start raising a lot of issues, and then what happens? The whole thing goes haywire.
Okay.
But as a patient, she was a wonderful patient. And of course, she was very well read, so we could really discuss each and every step of treatment with her in detail.
Okay.
She had a lot of questions to ask me, and I was so glad she asked me those questions, because all this really improves upon the treatment quality, because the patient confidence level increases dramatically.
Again, we come back to what we have been discussing, patients, how well educated the patient is.
Yes, which is very, very important. The patient should be well educated about the procedure. The patient should be well informed about the procedure. Each and every step should be explained to him or her in detail, which is very, very important. That's what we did in her case. And of course, meticulous planning, absolutely faultless planning, which we could do with the help of the digital OPGs and the CTs and a lot of other things, the clinical examination, the models which we made. So it was all meticulous planning, and it was teamwork, because it was not just me. I did the surgery, but I had my consultants also working on her. They did a fantastic job. My job was to place the implants, which was a very, very tricky affair, because she had very little bone in the front, in the upper jaw, especially in the front. And I had to remove 1 or 2 implants in her case, and then replace them with new ones. And there was a lot of work going on, a lot of carpentry work was done, literally, in her jaw. But then I'm so glad that it's doing that the entire prosthesis along with the implants, they're all doing extremely well. And I don't really expect any complication in the near future. Any problem in the near future, is what I have to say. And she's decided to keep coming to India, and she's always welcome as a family member of ours.